Welcome to Blue Phantom Simulation Studios. We're very excited to introduce you to our lumbar puncture, lumbar epidural, and thoracic cervical epidural training model. This product offers the same realism, quality, and durability that you've come to expect from Blue Phantom. We spend a great deal of time in clinical environments with clinicians like you, listening to how we can help you efficiently and effectively train others in order to improve the delivery of care to your patients while reducing the risk associated with performing procedures. Let me share with you the features and benefits of this training model. Blue Phantom's lumbar puncture and epidural training platform offers clinicians the flexibility of performing a wide variety of procedures, including lumbar puncture, lumbar epidural procedures, thoracic epidural procedures, and cervical epidural procedures. During procedural training, users can perform ultrasound-guided procedures or use blind insertion techniques to access the epidural or the subarachnoid space. The model is superb for needle access as well as placement of catheters. Blue Phantom's lumbar puncture and epidural training models can be positioned in the upright or lateral decubitus position, allowing users to accurately position the model for appropriate training scenarios. For lumbar puncture and lumbar epidural procedures, the use of external landmarks as the iliac crests can be palpated in the model to initially orient the user to proper access points. Further palpation of the spinous processes provides additional landmarks. The accessory obese spinal insert provides more adipose tissue, disallowing the palpation of the spinal processes. Each lumbar spinal tissue insert contains the lower thoracic spine and the entire lumbar spinal anatomy. Ultrasound can be used for identification of the optimal insertion points, angle of needle insertion, and determination of the depth to the ligamentum flavum, epidural space, and spinal cistern, which is especially important when performing procedures using the obese spinal tissue insert. After identifying the optimal cannulation site, the model can be utilized for full procedural training. Users can inject local anesthetics, introduce the needle to the appropriate cannulation site, thread catheters, and obtain manometer measurements, all while experiencing a realistic tissue response, including the pop encountered when traversing the ligamentum flavum, loss of resistance when entering the epidural space, and cerebral spinal fluid flow when the spinal cistern is accurately accessed. The optional thoracic or cervical thoracic spine insert allows users to practice thoracic or cervical epidural needle and catheter placements and shares the same superior performance and realism as the lumbar spine tissue insert. Users are able to perform epidural procedures, and cerebral spinal fluid is present in the model as a way of providing the user immediate feedback as to procedural complications. Our goal here at Blue Phantom has always been to deliver the highest quality of products with an emphasis on the realism, quality, and durability. Our acoustic engineers expend tremendous efforts to match the imaging characteristics of the areas represented in our models. That means that you can use any ultrasound system and will never have to adjust the system settings unrealistically or have problems imaging the model's anatomy. The realism you experience with our products optimizes your training.